All right, so good morning, good afternoon, and good evening. Depending on where in the world you're calling in from today, we're so happy you joined us for this session. Our topic today is community building at the intersection of formal and informal healing systems in rural Zimbabwe. And we hope that this is a practical and informative session to share what our team and folks in the community in rural Mwenezi, Zimbabwe, have been doing during the COVID-19 pandemic to both improve health and build peace. It is inspiring and interdisciplinary work, and it has been a real privilege to have been a small part of it. We hope that this session and learning from the experience in Mwenezi can also be of help to you in your context and in thinking about new ways to work at the intersection of peace and health. We wanted to start by briefly introducing ourselves. My name is Paul Shetler Fast. I'm the picture on the far right. I'm calling in from Goshen, Indiana, in the United States, and I'm the Global Health Coordinator for Mennonite Central Committee, which is an international faith-based relief, development, and peace organization. And in my role, I help to oversee and support our health work around the world, including the project that we'll be sharing about today. In this session, I'll be representing a public health perspective on the topic. Now, to my left on the slide is my wonderful and very wise colleague, Gopar Tapkida, who you will hear from next after me in the presentation. So Gopar, can you please just unmute yourself and briefly introduce yourself to the group?
Thank you so much, Paul. My name is Gopar Tapkida. I'm reaching you from Zimbabwe and originally from Nigeria. I work with Mennonite Central Committee as the country director for Zimbabwe. I will be, in this presentation, I will be focusing on the peace building aspect of the project. Thank you.
Thank you, Gopar. And on the far left of the slide is the real star today, representing all the great collaborative work on the ground in Mwenezi, and her name is Caroline Pougaini. So you'll hear from her after Gopar in the presentation. Caroline, can you please unmute and briefly introduce yourself to everyone?
Okay, good morning, everyone. I'm Caroline Pougaini, and I'm from Zimbabwe, from MCC Partners Co Against Poverty. Thank you.
Thank you, Caroline. So now that you know a bit about who we are, let me give a brief overview of what we'll be talking about today. First, I'll be giving some broad context on the colonial roots of conflict between formal and informal systems of healing in Africa and why this conflict matters today. Next, Gopar will be helping ground us in the context of conflict and peace building in Zimbabwe, and why using a multi-stakeholder, locally driven peace building process was important in addressing a public health crisis like COVID-19. After that, getting to our specific project and community, Caroline will give us an introduction to the community of Mwenezi, SCORE's approach to COVID-19, and the experience we had on the ground in this project. What has the project done? Why was it designed this way? And how things went. And finally, we will wrap up with each sharing our big picture lessons learned from our different disciplinary perspectives. So I'll share a few lessons from a public health perspective. Gopar will share some key peace building lessons, and Caroline will finish our time with local community development lessons. And after that, we should still have time for Q&A and discussion. So please, as we go along, feel free to put your questions or comments into the chat, and we will get to those in the order they come in at the end. So thank you so much for joining us. So as we start this discussion, I think it's important to zoom all the way out and consider more critically the idea of health and health systems. While health is often presented as a neutral, scientific, obviously good human universal, it is in reality more complex. We want to be asking, what do we mean by health? Who defines and controls it? Is a person's or a community's health best represented by the picture you see here? Informal medical records written in scientific jargon, accessible only through experts and stored behind lock and key? Or are there alternative understandings of health and healing that are worth considering and valuing? And we want to be extremely mindful of the colonial roots of health systems in Africa and what that means for the conflicts we see today between formal and informal systems of healing in places like Mwenezi, Zimbabwe. And as we reflect on this, I want us to start by considering this quote, which I find very insightful, by a historian of public health and medical science, Frank Snowden. And he writes, "Is medical science purely the technical application of neutral knowledge?" And this is how it's usually presented. Health is neutral, health is scientific, it is universally applicable, and all health systems are doing is applying that. Or instead, should we think of it as a cultural institution built by the dominant social groups in a society that in some ways may reflect their worldview, sometimes embody their prejudices, and may promote their interests? So I'd like you to reflect on that as we go forward in this presentation. Now, the medical specialty of colonial medicine, which then came to be called tropical medicine and later became what we know as global health, emerges out of colonial expansion and the health needs of colonial powers. Colonialism brought white Europeans into contact with new diseases to which they did not have adequate medical understanding, and those colonial systems required medical management of local populations in order to secure economic and political power. Missionary medicine often worked alongside colonial health systems as a complement of the state and the civilization that it represented. So colonial, missionary, and tropical medicine were defined by dichotomies of power that more broadly characterized colonial hierarchies: colonizer versus colonized, Europeans versus natives, regular medicine defined by and for the West versus a specialty medicine for people in places that were seen as other or lower or less than, a two-tiered medicine depending on place in society, location, ethnicity, and race. Now, in the 18 and 1900s, most colonial governments had a medical or public health branch. And while framed very positively in terms of caring for the locals and bringing modernity, there was always explicitly it was there as an instrument of power and part of a political process. And even some of the most hallowed institutions of global health today have these roots. Zimbabwe was colonized by the British, and as historian Anna Greenwood explains, Britain realized that without the tool of medicine, conquest and the maintenance of British supremacy globally would not be tenable long term. And this led directly to the founding of the London School of Tropical Medicine. Again, one of the most hallowed names in global public health today, and many other institutions would have similar histories. And the same is true of the colonial health infrastructure that Britain was building on the ground in its colonies. The institutions and structures that at independence became the Ministry of Health and its local hospitals and clinics. And this colonial medical system that was being built, while it did do some great good for some people, it also did harm, and it seeded the conflicts that we see by being built on and defined in opposition to traditional and informal healing systems that it found on the ground. So this Western, colonial, modern, scientific, Christian formal health system was defined in opposition to the supposedly backward, superstitious, traditional local practices, and that continues. The system that was developed, the formal system, often ignored a holistic vision of health and healing, which went beyond the individual physical body of one patient. So instead of traditional systems, which tended to see health as part of a community, part of culture, part of religion, it tried to see it as this separate thing, this physical process that should be managed in a different way. Formal health systems also retained a sense of cultural superiority and generally a one-way communication and one-way service to the community, not seen as a relationship. But despite this history, we see a resilience of traditional and alternative informal healing systems across Africa today, and in communities like Mwenezi. Sometimes these are systems that we ignore, that we marginalize and push aside at great cost. And I would suggest that as we think of these alternative systems, we not think of them from a colonial frame of superstition, of illogic or backwardness, but instead as a source of strength, of deep cultural values, and of alternative paradigms of healing that we all might learn from. And I'll leave you with this quote before I turn over to Gopar from the historian of health and public health in Southern Africa, Rebecca Lee, who wrote, "The resilience and robustness of medical pluralism," so using multiple systems of healing in Africa that we see today, "is a testament to the autonomy and decision-making capacity of African patients as skeptical clients, as self-carers, who are adeptly operating within different publics, different therapeutic regimes, and across different conceptual registers." So I will turn it over to Gopar to take us on the next leg of our journey.
Thank you so much, Paul, for laying that very great foundations to the presentation. For most of us, when we talk about project implementation, we are concerned about how the concept is designed and the proposal is written, but there is a lot that goes into at the background before arriving at the concept writing and the proposal writing. And from the presentation that I'm going to give you here, I'll be looking at the conflict and the peace building aspect of this particular project, without which the implementation wouldn't have been possible if SCORE had not looked into the conflict factors and addressed those factors. So I will be presenting to you beginning with the conflict factors now. So Paul, can you move to the next slide, please? Why COVID-19 required more than just health? The history of violent colonial and post-colonial era in Zimbabwe, a book review by H.L. Smith in 2013. He lay in this book the impacts of all of these wars. He pointed to the Liberation War of 1960 in Zimbabwe, the Liberation War in 1970, 1980, and how people were impacted by that particular war and how people are continuously impacted. In fact, he titled it the continuous suffering in Zimbabwe. While some people fought for conquest, others fought for survival. Today, we are witnessing controversial elections and political rivalry in Zimbabwe, characterized by violence which has continuously factored increasing number of people who are hurting, who are bitter, who are angry, who are traumatized, and who are disenfranchised. I am laying down for you the context in which this project was implemented. The next factor here is the mutual suspicions among the different faith groups. The rise of contemporary prophets versus the traditional prophets, mostly opposed to each other, leaving the followers in conflict and confusion due to the phenomenon of ethnocentrism and syncretism. And another point is the rising tensions between the formal and the informal health system, what I call the Ministry of Health, which is the formal system, and the Ministry of the traditional health system. In peace building, perception is a reality. You may think, what is this about traditional system? Is that a primitive system? But for the traditional healers, the conventional system is what they call the primitive. And as far as they're concerned, the formal health system is even more primitive than their own. So, especially for the traditional health system, they look at their system from a holistic perspective. It is all inclusive. It is not about the physical aspect, but also including the spiritual aspect. But for the conventional system, it is about science, about testing, about proving, And worst of all, they will tell you that there is no cure. The traditional system will laugh at the formal system when they describe the disease. They say there is a disease, but there is no cure. As far as the traditional system is concerned, there is no disease that there will be no cure. And so those are some of the tensions that there were in the community. Another one is the incidence of security brutality. Here, people will say that some people are more afraid of the security operative than they are of armed robbers. Why? Because the security operatives have not been trained to manage non-violent activities, non-violent principles. And so it becomes very difficult for them to enforce the COVID-19 measures non-violently. And so that was one of the major factors that this particular project was launched in. The next slide, Paul. The prevalence of domestic violence. This is to say that domestic violence is ongoing, has been ongoing in Zimbabwe and like anywhere else in Africa. However, with the advent of COVID-19, it led to the loss of jobs and the loss of informal businesses. When we talk of informal businesses in Africa, that is huge. It means no food, no school fees, and no money for education. So lockdowns actually increase the anxiety because people stay at home 24/7. You will hear stories of people who lost their job in other countries and return home and stay home 24/7, looking at each other with their wives and their children. And this increased anxiety and anger, hence the transfer of aggression, leading to more gender violence and domestic violence in many cases. Another point is the myths and the misperceptions of COVID-19. All of us are aware of many of them, like the artificial creation, that's one of the myths. The fabricated virus to force vaccinations on the citizens, that's another myth. The connections of this virus with 5G is another myth. Population management, all of these are myths. And in these rural communities and Mwenezi, for example, another myth is the issue of witchcraft. And this was causing a lot of tensions and conflict among people. Again, as I said earlier, perceptions is reality. And so we can't write this off and say, what is witchcraft? We cannot write this off. Another point is the strict regulations to COVID-19. This became a recipe for increased violence in a number of communities or number of situations. How we value here in Africa, we value social interactions, social gathering, handshaking, hugging, attending festivities. But for COVID-19, we are told no touching, no handshaking, no movement, no hugging, no wearing face masks. The banner on the left there talks a lot. You can see that banner if you can see it from where you are. Some of these regulations are written there. And these people will say, what kinds of sickness is that? Have you come? They will be asking that sickness. Have you come to destroy our culture? And so we must console our ancestors about this. It is not just about addressing COVID-19, but it goes beyond that. And we will hear some of these stories later on from my colleague. And another problem is the problem of coordinations among the various stakeholders in the community. Here we have the communities are so diverse. We have formal and informal health system. We have faith groups, and you'll be hearing stories about these faith groups and the different groupings that are there. We have the security and a host of others. So how can all of these different groups work together to implement this project? So it's not just about bringing a project and implementing it in the community, but it is about how do we collaborate and coordinate the different various group stakeholders that are there to address this COVID-19. The next slide, Paul. So The locally driven multi-stakeholders peace-building approach, which was launched in Mwenezi, provided an opportunity to address the pre-existing conflict conditions that I mentioned earlier on. And it also provides skills for the police to non-violently enforce COVID-19 protocols. Instead of using violence, now they have learned the skills of non-violence to apply in enforcing the measures of COVID-19. It also provides a platform for mass participations of stakeholders to build a buy-in and support smooth implementations of the projects. SCO alone will not implement this project. They need people. They need stakeholders. And so this particular peace-building activities provided a platform for the mass participation of stakeholders. And then second, furthermore, it provided a platform for the emergence of the project into the local culture and context for local ownership and sustainability. We are not only addressing health, we are looking at how does this impact the culture and how does the culture receive this particular, the new project into the culture for sustainability, for ownership, and looking at the long-term goal of implementing not just this, but any other project in the future. Then the last point I have here is the platform for coordinating and communicating with all of the stakeholders to implement a project that was already a suspect. We talk about the different myths about this project, COVID-19, the different myths. And so how do we implement this in this particular context that was so diverse? And so the peace building aspect provided some kind of a coordinations, and it provided some kind of a communications among the different stakeholders to impress a project that was already a controversial project. So here, the context was so diverse, the project itself is controversial, but because of the methodology that was adopted to bring in peace building approach, they were able to implement this particular project. And we'll talk about the lesson learned about this later on. I would invite my colleague, Caroline Pougaini, to lead us through the practical aspect of the implementation of this project. Caroline.
Thank you so much, Gopa, for this opportunity. I'll take the response to COVID-19, which was done in Mwenezi District. Can go to the next slide, Paul. Okay, I'll first of all introduce you to Mwenezi District. Mwenezi District is a small district which is located in agroecological region 4 and 5, and it received a minimum of 500 milliliters per year of rainfall, and most of the people rely on rain-fed agriculture. It is close by the South Africa-Zimbabwean border, and most of the people migrated from Mwenezi to South Africa to look for jobs. So it is prone to food insecure, as you can see on the map. Can move on to the next slide. As a score against poverty and implementing partner for MCC, we have implemented the COVID response program, and we have been using numerous approaches to the project, which include the grassroots mobilization, interfaith multi-stakeholder approach to avert conflicts between medical and traditional belief systems, encouraging collaboration, respect, and acceptance of different health systems to combat COVID-19 and mitigate conflict and distract between formal and informal healers. At the same time, there was provision of personal protective equipment and safe spaces for isolation were created. Awareness raising through mobile text messaging, radio, and banners. Psychosocial support for healthcare providers who work within the isolation center. Can move to the next slide. What the project has done. The project has built trust and strong collaboration between different health systems, including building a multidisciplinary COVID-19 coordination team, which was not there. Actually, currently we have a vibrant, strong coordination team. it established the isolation center at our National District Hospital. At the same time, 7,324 individuals enrolled in mobile text messaging blast platform, sending messages in local language, which include English, Shona, Ndebele, and Shangani on COVID prevention, awareness raising, and vaccine promotion. It established the health clubs and support safe opening of schools, PPE material access for frontliner providers, vulnerable groups, and those that tested positive, including at traditional gatherings such as funerals. It also do contact tracing through the mobile text messaging, which helps reduce number of cases and insecure proper management. Can move to the next slide. Okay. I'll go on telling stories of what we did as we were implementing this COVID-19 response. We renovated the isolation center at our local district hospital, as I've already mentioned before. As you can see from the pictures, we managed to renovate an isolation center that accommodates 14 patients. And as you can see, traditionally, women are not allowed to do men's job. Building is regarded to be a male jobs. So women are not supposed to participate in building. Henceforth, SCORE, with its collaborative approach and peace building approach that was used, we managed to train female builders, which helped us to renovate the district isolation center. As you can see, these are ladies which are trying to renovate. Some are in building, some are in electrical, and some are painting, as you can see according to the picture. So it's a success story that we are proud of and that we are happy to share with you. You can move to the next slide, Paul. Okay, my second story is all about the isolation center as well, but focusing on the hand washing points that was crafted and constructed locally in Munez District, as you can see from the far right picture. We improvised the foot-operated hand washing stations, which we placed at our isolation center at the district hospital. This machine was improvised with the people within the district so that we can curb the spread of the disease. At the same time, despite renovating the building of the isolation center, we provided linen material, as you can see from the picture in the center. We provided linen material for the isolation center as well. At the same time, we managed to establish a screening point, the picture to my far left, screening point, which was placed at the gate of the hospital, where people are being screened before entering into the hospital. Can move to the next slide, Paul. Okay, the mobile text blast messaging. The COVID awareness raising was done through this mobile text blast platform. And as I've already mentioned, that it reached out to many people. And this message blast platform, it was convenient in such a way that it was accessible with the local people, even those with basic phones or smartphones, especially women. Within my district, culturally, women are not supposed to say anything or decide on anything. Actually, the men are the heads of the house. And women, we are meant to be submissive to our husbands. So in any case, it is always men who own the smartphones that have access to Twitter, Facebook, and WhatsApp, where most of the information are being disseminated and shared. Women are commonly own the basic phones, as it is shown on the picture there. That women is holding a phone. It's a basic phone that cannot be connected to WhatsApp or Twitter or any other social media platform. So this blast platform was convenient in such a way that it accessed even those who has the basic phones. At the same time, it targeted the key groups which are more influential within communities, which we used to cascade even more information to others, like traditional healers and prophets. social welfare, child care coordinators, farmers and general community health care workers. Blast text messaging that we were using, it was also a strategy to get community feedback. It was also convenient in such a way that people can send feedback through that blast without fearing that they will be known that maybe if I report my husband through the blast platform, he will not know that I reported him to the ministry. So it was a safe way of communicating where each and everyone was very flexible to communicate, to report, or even to respond or to complement all the messages that they were receiving. We can move to the other slide. There was distribution of personal protective equipment, material to schools, vulnerable households, as I've already mentioned. We managed to distribute PPE material and manage funeral, as you can see on my far right picture, where we managed the funeral. Also, we distributed PPE material to the Ministry of Health. Clinics and hospitals received PPE material. We managed to manage all the funeral. Culturally, in my community, gathering are the most important activities that are respected, and each and everyone will be willing to attend, especially funerals. Each and everyone is supposed to attend a relative's funeral, or even one of the community members. If one of the community members lost a member, each and everyone in that village is supposed to attend the funeral. So it was very difficult for people to understand that COVID-19 restrictions do not allow them to attend funeral gatherings in numbers. At the same time, do not allow them to do the burial ceremonies as they used to do. Normally, under normal days without this pandemic, the funeral rituals were attended in such a way that the family members and relatives could spend 2 days camping at the funeral point, where the body will be brought in and stay in the house overnight. Women will be inside with the dead body singing overnight, while the men are seated right around the firewood. Then tomorrow they will bury the body. So with the COVID-19 regulations and protocols, it was not allowed to do so. Henceforth, there was a lot of conflict that arose within the community. At the same time, each and everyone was pleading to attend. So as SCORE and Ministry of Health, together with the interfaith, we make sure that there was availability of hand washing facilities, PPE materials, and other things that were required. We can move to the next slide. Okay, the multi-stakeholder engagement and coordination. As you can see, we managed to coordinate with traditional healers, traditional leaders, relevant ministry and government ministries, Ministry of Health, together with the police. So to my far right, there's a picture where we were having a training meeting for the coordination team, which involves the chiefs, the DA, and other members. On my far left picture, there is a picture with the police. We tried to train the police so that they can be able to implement or to enforce the COVID-19 protocols peacefully. At the same time, we managed to train them so that the community will understand and accept them whenever they will be enforcing those protocols. So instead of the public to run away from the police, we were aiming to make sure that the public will be running to the police for safety and protection instead of running away from them. So we managed to maintain the good relationship between the police and the community. And we managed to make sure that the COVID-19 protocol enforcement process is being done in a peaceful way. Can move on to the next slide. Okay, the interfaith work on COVID-19 awareness and prevention and public health promotion. As you can see, the picture on my far left, there is those prophets who are praying for that lady. Actually, it's myself. We trained the interfaith health systems on how COVID-19 regulations must be respected and followed. So we were trying to come up with good strategies of doing things. Under normal circumstances, it is believed that when the interfaith members are praying or assisting somebody who is not feeling well, they should touch the body directly as they will be praying. So with the coming in of the COVID-19, it was very difficult and it was unacceptable for somebody to touch the body or even the head of a patient who will be coming to their help places. So we encourage them to look for other ways of doing their work. So that's how they are now doing their work. You can see that man who is holding the stick is not meant to beat the lady, but actually it's a holy stick that they are now using. They are coming up with other strategies. They are now using holy sticks to pray for people. The spiritual power will pass through the holy stick up until to the sick person so that she can be assisted. At the same time, the next picture is showing the traditional healer in his surgery. They call them surgeries, the shrines where they do their work, together with the SCORE member and the Ministry of Health, coordination, nurse. This picture really shows that there is a coordination. The coordination was actually created and is functioning. They accepted that they should work differently than before. But the challenge now was that, yes, as traditional leaders, as I'm speaking, I'm a normal person. I understand, you have trained me and I understand everything that you are saying. And I'm sure I'm scared of COVID-19. But the challenge is when I'm working, it will be the spirit, I will be seized by the spirit. It will be the spirit that will be working inside my body. So the spirit doesn't know about COVID-19. So how best can we help each other so that we keep on maintaining those and following those protocols? So a traditional ritual ceremony was done, whereby we were appeasing the spirits and telling them that there is COVID now. The body that you occupy when you are working needs protection. So you really need to understand that there is COVID these days. So they need to use sanitizers, they need to wash their hands, they need even to work at a distance from the patient instead of getting closer to the patient. Then at the same time, as you can see, the other picture is showing the mothers from a church group which were being trained, the elder mothers from a church group which were being trained on how to do and to go about it. Because mostly these mothers are meant to pray and help the young ones, the infants. So we were just training them on how best they can do it. At the same time, as women, they are the caregivers at home, even at the church. So we're just trying to train them on how best they can protect themselves against contracting COVID-19. We can move on to the next slide. Over to you, Paul.
Thank you, Caroline, for that excellent presentation and perspective from Mwenezi. So to finish out our presentation today, we'll each end by sharing some of the key lessons learned in this project from each of our different disciplinary perspectives. So I'll share a few lessons from public health. Gopar will share some thoughts from a peacebuilding perspective. And then Caroline will bring our presentation to a close by sharing her key takeaways from a community development perspective. And then, like I said, we should have time for some questions. So if you have questions for Caroline and Gopar, or for any of us, please put those in the chat. So from a public health perspective, there are three key lessons that I'd like to highlight here for you. Number one is that history and context matter. They always matter, no matter where in the world we're working. And I hope that the struggles of public health during COVID-19 have reminded us of that. Health and medicine are always culturally and contextually embedded, and we should not pretend that they are not. So a major lesson is to be very skeptical of any project that simply copies and pastes an intervention from one context to another. The world and people are more complicated than that, and we have to take people's rootedness in culture, context, values, and history seriously if we hope to understand where they're coming from. Number 2, health is more than clinical medicine, and we must engage people in their complex wholeness, not just as universal physical bodies. So yes, some elements of medicine are universally applicable, but we do not show respect for our patients and the people we serve when we erase everything else that matters to them and makes them who they are. This is one of the major reasons so many people seek out alternative and informal systems of healing in Zimbabwe and actually around the world. This is also why SCORE developed such trust by listening to what mattered to people and working with them to make those activities safe during COVID, rather than just telling them, no, you can't do that. So whether it was funerals or traditional healing ceremonies, SCORE took seriously people's culture, their values, their traditions, and it worked with them. And we in public health can and should learn from that kind of an approach. Which leads us to number 3. Public health requires trust, and trust requires relationships of respect and mutual understanding. Not coming in just as experts, talking down to people, not writing off their beliefs as superstitious or conspiracies, not setting up one-way communication channels simply to educate people, but instead meeting people where they are on their terms, respecting where they come from and what matters to them, and working to earn their trust, earn their respect, rather than demanding or expecting it. Now I'll turn it over to Gopar for his key lessons from a peacebuilding perspective.
Thank you so much, Paul. And thank you also, Caroline, for that elaborate presentation. I have also 3 key lessons from the peacebuilding perspective. All of us are used to environmental analysis, gender analysis, power analysis, and all kinds of analysis when we are developing a project plan, project proposal. But very few people talk about conflict analysis, especially when the project is not conflict focused. But from these particular implementations of this project, we have learned that it is very important to include conflict analysis in identifying some conflict factors in every project that we try to implement, especially the fact that we know as peace builders that conflict is inevitable, which means that in every community, every situation, there are conflict factors that are there. And so how do we address them? Should we just close our eyes and just implement the project we want to implement? We may not be able to realize the outcome and the achievement that SCORE was able to achieve in a very difficult and complex situation. And so I think this proved to us that doing conflict analysis for almost every project is very, very important. The second point is about genuine mobilizations and coordination. We have heard about the diversity in that community. Without genuine mobilization and coordination, it would be impossible to realize a collaborative outcomes. And so one of the major lessons here is that if we are able to genuinely mobilize people and to work together and to coordinate, it is very, very possible to achieve a collaborative outcome where everybody is happy and excited with. The third and the last one is what I would say: development without peace building integration is an effort in futility. And I will just link this up with a story of the bridge that you are seeing on the right-hand side. This is a bridge that was built by the community. This community is known for violent conflict since the time of colonialism to post-colonialism, and now about the time of democracy. This community has been fighting each other. When it comes to democracy, they divide themselves along political lines. And so the community is so divided. And there are stories of how they have been fighting and destroying all kinds of development in their community. Then one of our partners introduced peace building in that community, and they themselves decided to build a bridge connecting the two communities that have been fighting together. and they called this a peace breach. And the community themselves said, don't give us development without peace, because if you give us development, we will destroy that development through violence. But give us peace, and we ourselves will develop our community. And this is one example of that. And this rhymed together with how SCORE was able to bring about the to achieve a development factor in a situation that was completely very diverse. Thank you. Caroline, you can talk now about your lessons.
Thank you. I will take over to community development lessons. There was misconception between traditional and informal health system. It was noted that it can derail progress on mitigating pandemics. Trust and collaboration are important for effectiveness. So misconception between traditional and informal health system can derail progress on mitigating pandemics, trust, and collaboration. So these three aspects, they are very important. Mitigating trust and collaborations are important for effectiveness, which as SCORE Against Poverty, together with Mennonite Central Committee, managed to use as a tool to respond to COVID-19 in Munez District. Secondly, technology allows for better feedback with the community and can support better contact tracing. Mobile text messages allowed for contact tracing in privacy, and it helped people to seek assistance in a convenient and safe way without fearing being identified. Blast messaging was a very convenient way of communication, of giving feedback, of reporting issues related to COVID-19, issues related to conflicts which were happening within communities, be it in terms of maybe sickness that were happening due to COVID, and the community were regarding those sicknesses being caused by witchcraft. So there was a lot of fight and relationship destruction between friends, relatives, and family members. So the blast message has been proved to be a convenient way of communicating. Thirdly, technology can be used to raise awareness and provide much needed information to communities in ways that are safe, contextualized, and complying with COVID guidelines. The blast messaging reduced the direct contact to the recipient, which was one of the main COVID-19 guideline or protocol that was imposed. So technology is also, it can be used to raise awareness. As you can see, we managed to raise awareness through that mobile text platform, and we reached out to a lot of people. And it provided all the information that they were needed, that they were in need of, which was correct and reliable, instead of those myths that was spread in a safe way and convenient way, timely. Can move to the next slide, Paul. At the same time, pandemics or crises can lead to development opportunities. It is not all pandemics or all crises that will create a negative impact to our communities or our countries, but instead at some point, those crises and pandemics, they create a lot of opportunities that will bring a positive change within communities. The coming in of COVID-19 enables us to engage into this COVID-19 project with the approaches that we were presenting before, which enabled traditional and formal healthcare system to work well together, unlike before. There are now referral system, referral points. There are now communication, information dissemination points within communities. The Ministry of Health is referring patients to the traditional and interfaith ministry, while the interfaith ministry and traditional healers are now referring some of the patients that are coming for help with COVID-19 symptoms to the hospital. Also, opportunities for women to access services is critical. Women are the most disadvantaged people, especially with the coming in of the COVID-19 within my communities. They are the ones who are the caregivers, as I have already mentioned before. This was particularly crucial as women were the most impacted by COVID-19 and least well served by existing outreach strategies and services like communication. They were not able to access appropriate information about COVID-19. At the same time, traditionally, women are being taken as baby minders. They don't participate in decision-making process or have access to information or access to any resource within the community, even at household level. So it was very difficult for women to stand up for themselves and protect themselves against COVID. So it was very important for us to make sure that information was disseminated and women recipients were able to receive that information. At the same time, due to the geographical location of Munez District, as I've already said, most of young men migrated to South Africa to look for jobs. Because of COVID-19, most of them lost their jobs and they returned back home. With the COVID-19 protocol, with the COVID-19 regulation that each and everyone who have been traveling from another country coming home should quarantine for 14 days. It was very difficult, particularly for women, to tell their husbands to quarantine because it's not prohibited according to the culture. You can't resist your husband when he's back home after 5 years, 5 good years working for the family. Then one day he came back and he said, no, because of COVID, you can't come close to me. You need to quarantine for 14 days. It leads to a lot of family distraction, a lot of divorce cases and gender-based violence cases were reported. At the same time, indigenous knowledge systems are usually appreciated, yet they are often more culturally and contextually grounded, accessible, and responsive to communities. With the coming in of COVID-19, the indigenous knowledge systems and traditional healers were not recognized. It was only the formal health system which was being talked about. And every issue related to COVID-19 was being referred to the formal health systems, underlying or eliminating the indigenous knowledge systems within communities. So it was very important for us to integrate them, since they were also frontliners, since they were also health care workers, but they were working under the indigenous knowledge systems. Thank you.
Thank you, Caroline, and thank you, Gopar. Really inspiring and wise words, important lessons for us to take. Again, thank you all for being here, and we'll open it up to questions. So please put any questions you have in the chat, and we'll get to them as we have time here. Let me stop sharing so that you can see us. And the first question that that came in the chat that I'll pose to either Caroline or Pougaini. So it's this question about what happens when people use alternative healing systems or ideas about wellness or complementary medicine to promote vaccine misinformation, COVID misinformation. They use these sort of alternative, the legitimacy of alternative health systems to spread misinformation or unhelpful information. So how did you deal with that, Caroline, on the ground? How did you confront misinformation or set the record straight or provide useful information in a way that also sort of respected where people were coming from?
Thank you so much. As a score against poverty, it was very difficult. It was not easy for us to successfully implement this project in Mwenezi District due to its patriarchal background, its traditional setup. So with the multi-stakeholder approach, we managed to integrate all the members involved, especially the more influential members, which include...
Oh, you got muted, Caroline. Oh, there you go.
Which includes the interfaith, the traditional leadership, which involves the chief, the village heads, the headmen, the councillors, the DA, the relevant government ministries, together with the Ministry of Health. We discussed these issues related to COVID-19 and unpacked how it is spreading within communities. So we come up with the need for us to implement this project. But at first, we face a lot of resistance from different people, because it is very difficult to just change what people used to do and enable them to do things within communities. At the same time, the other issue that assisted us to successfully implement, in fact, one of the things that SCORE is strong on in Munez District is that we are from Mwenezi. I'm from Mwenezi. I was born in Mwenezi. So whenever I'm talking issues with the people in Mwenezi, it is easy to buy trust because they know us. They really know us. And they understand that as implementing agent, we are from the same community. We also understand them. We understand the culture within the community. So as children from the same community, which were born from the same community, and now we are coming back with new strategies, coming back with new development that will improve our communities. It was easy for us to buy their trust. At the same time, with the Ministry of Health, it was a little bit, there was a lot of hiccups with the Ministry of Health together with the traditional leaders, the traditional healers. The traditional healers were saying, no, we run our things on our own way. This is how we do our things. Whenever we visit patients, whenever maybe my niece is admitted or else one of my patients is admitted at the hospital, if I visit that patient and try to help, the health workers, the informal health workers will chase us away. So by so doing, we don't want to work with them. They should work alone. So we tried our level best to unpack how COVID-19 is spreading and the agents need for us to respond to it so that we can be protected. So that's when all of the members decided to come in and actually accept the approach and the strategy and the program. And then we move, as we were moving forward with the bottom-up approach that we were using. In any way we want to do anything, we have a coordination meeting where we do the planning process, where each and every member will be available and will be also giving his or her input. So we accepted them with what they are, with whom they are. We accepted them, be it traditional leadership or the formal or the community leaders. At the same time, we give them a listening ear. That was how we managed to convince the community to go for the program.
Thank you, Caroline. That's very inspiring work, and I think a real model of getting those diversity of perspectives to actually work together on a cooperative project. And we haven't seen that in too many places during the pandemic. So really, really well done. The only thing I'd add on that, because this is an issue, the question even mentioned in the West, here in America, this is a problem. In many countries it is. But I think it's often not a problem of like science versus not science. Like a lot of the people who are promoting misinformation or promoting their own agenda are using a scientific paradigm, are using the tools and the sort of framing of the formal medical system. So it's not the case that it's just like an us and them, a science versus not science. It's more complicated than that. And I think the big question that folks have to ask themselves when a significant chunk of the community is not believing what public health is telling them, not believing what doctors are telling them, but believing this other narrative about what's happening, the misinformation, let's say, then the question is why? Like, why is that more compelling? Why is that meeting them where they are more? Why is that a more believable source of information? And really doing the work ourselves to earn that trust, rather than just telling people they're wrong or fact checking them, which is usually pretty ineffective. So I really liked how, Caroline, how you answered that with how the slow and hard work of building trust. The next question, which is for you, Caroline, the writer says, I'm so inspired by what you were able to accomplish despite all the lockdowns. Thank you also for including police in your project. I'm curious if you heard from them any example of how they were able to implement their trainings or use their trainings. Can you speak to that? And Gopar, if you have other things you'd like to add to that after as well, you may.
Okay, thank you so much. After incorporating the police within our in our project and managed to train them, we also did some checkups with them at their office, at their base camp, and even observe as they were enforcing the COVID-19 protocols within the community, within the business center, within the locations across Mwenezi District. We had a lot of reports that people are abiding by the COVID-19 protocols, and the police is now working together with the community to enforce, because at some point the traditional leaders is now taking the enforcement role and enforce the protocols within their community. So the police engaged the traditional leaders and they trained them. They sort of like decentralized the enforcement process. It was not based on themselves alone. They also trained the traditional leaders on how they can enforce those protocols within communities. At the same time, there was no cases of misunderstanding between the public, the general public, and the police, because before we were receiving information, when we were trying to raise awareness through the blast, we were receiving some complaints. Say, we understand that there is COVID, but why is it like police are just after the general public? Is it like I'm not supposed to work for my family? They are always after us as vendors. So we are trying to explain things to them. At the same time, currently we are receiving messages. Some of them are testimonies. Say, one of the days when I was trying to go for shopping, I meet this policeman, and he instructed me not to without wearing a mask. And now my friend who resisted has contracted COVID-19, but I'm protected because I get the advice from the police. So I'm very happy that the police is now assisting us in a peaceful way. He was able to approach me and talk issues related to COVID-19 and the importance of wearing a mask, other than just running after us and beating us. So those are some of the testimonies that we are receiving through our Message Blast platform. Thank you.
Thank you.
I would just say that I'll just add very little here. That thank you so much, Caroline. That you may not hear directly from the police itself, but you see from their actions, and especially the fact that they knew that people were running away from them, and the problem was not really with them per se. They would like to do the right thing. Is the problem of capacity, not having the skills to respond. And you will hear the police says that the police are your friends, but then people don't see the friendship. When what people see more of the harassment, when the police are trying to enforce law and measures here, they use force. So this project and one other project that we are supporting in this country is helping the police to learn the skills to non-violently work with the civilians population, and you will hear the testimonies more from the people themselves. The people who are running away from the police, but now they run to the police, and that's exactly what we want to see happen, so that the police will provide security, provide protection, just like what Caroline have just mentioned here. And we have had stories of Zimbabwean police, many of them now that have been trained especially, are becoming more humane in approaching the civilians. They will talk with you more politely. In fact, some will introduce themselves before they will even ask you questions. So, but in the past, that was not the case. That is not the same with all the police in Zimbabwe, but this is what I'm saying about the police that have been trained. Thank you.
Thank you, Gopar. The next question, I'll start with you, Gopar, as one of our most experienced peace building experts in our organization, and then maybe go to Caroline after for some of her ideas from what she experienced in Mwenezi. So the question is, They say the role of trust in building relationships is so important, as you noted. What do you consider the most important approaches for building constructive relationships between local government, service providers, and citizens? Gopar, do you have advice on how do you effectively build trust?
Paul, your your introduction of me is so humbling here. I don't know if I'm the most experienced peace builder in the organization, as you mentioned. I was building of trust actually depend on so many variables, but especially on you who is helping to build the trust. People look at you. They don't pay attention much on what you say, but how you behave is very, very important. And people watch you more during crisis situation. How do you respond during crisis situation, pandemic situation like this? It's not just about standing up and making presentation and training or doing facilitation, but they watch over time and see how you respond to the situation itself. So it is the whole of your life that is actually the facilitation. I usually say that the time we spend in a four-corner room to make a presentation is just very little. It makes very little impact in the life of the people, as much as our own behavior as facilitators. So it is more about our own behaviors, how we respond to situations. I don't know, but you know, this thing is mystical. I would say that it is our heart that communicates to the heart of another person that will bring about the strongest transformation in the heart of the person who is listening to you. And so if one is a fake facilitator, I promise you, it will not bring about transformation. People will listen to you. They will get head knowledge. They will get the head knowledge and they become very wise, head knowledge. But in terms of true transformation that can stand the test of time, it has the communication has to come from your heart, because our hearts actually communicate to each other mysteriously without us knowing, and that's what brings about transformation. I have worked in situations of Christian Muslims where former Islamic fundamentalists became transformed and became peace builders, and the same with Christians. And you would ask the question, what did I do? Nothing. It's actually the sincerity of communication from the heart to the heart of the other person. If you interview them, they may not even have a concrete thing to mention apart from the fact that they trust what I was saying. Why do they have to trust what I was saying? It is the communication from the heart. That's what I would say.
Thank you, Gopar. Wise words. And yeah, I mean, it echoes something that when I train people in public health, I tell them, you're a much worse actor than you think. So if you actually don't like someone, they are going to know that. If you don't trust them, they're going to know that. If you are telling them false information, they're going to pick up on that. And so that integrity, that honesty with which we communicate, heart to heart, as you say. Thank you for that. Caroline, do you have anything you'd like to add from sort of what was it that allowed you to build trust locally? What helped most with that?
Okay, thank you so much. Like what Gopar said, that was the strongest weapon that we used as a score against poverty. I myself, I'm a Christian, and I also attend those white garment church gathering. So from my background as a Christian, from my church background, I tried my level best to lead by example, to show how things are done, starting from myself, my family, my church. Even if when I go to church at first, when we're allowed to go to church, I get there, I use my mask, I wash my hands. So each and every day, people were just turning back from the resistant side and coming and joining us. Even the staff members that we were implementing as a SCORE family, we were also trying our level best to lead by example. So we were leading by example. Whenever we meet somebody, we discussed about the COVID-19 issues, making sure that we maintain social we have the mask that is required. It is not all about just preaching about something that you are not able to do. You should show them that you can do that thing and it can be done easily. That was the other thing that enables us to build trust. At the same time, like I've said, I'm from the same community. My parents are from the same community, and even my relatives are from the same community. So I also take that opportunity as a woman. I'm a fourth born in my family, and being a fourth born and a girl child, I was not allowed to decide within the family according to our culture. I was just being a child who was being raised and socialized in a way that all girls and women are trained to be. So by standing up in front of my elders and trying to explain things to them, that was not even happening before. It was something that was very difficult, but at the same time, I managed to the community managed to gain trust through the way I did and I present myself as a lady. Even other women's were coming in and represent other women's at district level. They were even attending the coordination meeting and even standing up in front of people and explaining all of the challenges that they are facing as women from a women perspective. So I think Gopa had said it all. You need to tell people to do what you can do. At the same time, if you want people to follow and do as you say, you need to start it from your home up until you go to the community. Thank you.
Thank you so much, Caroline and Gopar. You are both inspirations for your wisdom and all you've accomplished. And it's been such an honor to walk alongside you both in this project and to see all that you've been able to accomplish. And thank you for taking the time to be with us today and present from your perspectives. And thank you to everyone who's joined and for your great questions and for your feedback. Thank you very much. This is the end of our time. So thank you all very much. If you have additional questions, you're welcome to stick around, but otherwise we will end this session. Thank you.
Thank you, Paul. I appreciate it. And thank you, everyone. Caroline, thank you as well.
Thank you so much. Thank you, everyone, for attending. Thank you, Gopa and Paul.